Now, let's talk about vitamin K, and nutrition majors pay attention because again, this is your field. But the thing about vitamin K is a class of compound. It's not just one chemical. So here we have two or like three of the types of, like these are all considered vitamin K. They're just different variants of they're all part of that same group we call vitamin K. Now, the thing is that it aids in the formation of several coagulation factors. So the things that, even though these coagulation factors, like we talked about with those Roman numerals, at their core, they're a protein, but the thing is that a few of these coagulation factors actually need something that's not a protein to actually have its enzyme function. So vitamin K is not a protein. It's a chemical, but it's not a protein. But it's important in the actual enzymatic function of some of these factors. So vitamin K, so in the mnemonic, and actually this is why it's called vitamin K. It's like, why do we go from vitamin A, B, C, D, E, and then skip F, G, H and go to K? Well, I think, were they German or Dutch? But coagulation is literally spelled coagulation by, in the native language of I forgot his name, the scientist that discovered vitamin K. So vitamin K stands for coagulation. So where do you find vitamin K? You find it in things like leafy greens. Yeah, and you also find them in fermented foods as well. And let's see, I see a question, and we'll get to that really soon. But can anyone think of a leafy green that's also fermented and also starts with K? Yep, so that's it. Kimchi. So this is my other mnemonic. I think of it like vitamin kimchi. So I think it like, okay, the kimchi comes from a leafy green and it also is a fermented food. So, I mean, it's not the only one that has vitamin K, but yeah, kale is a leafy green that has a lot of vitamin K. So, this is my little mnemonic of what foods have a lot of vitamin K. Now, why is that important to the coagulation cascade? Now, more advanced classes in med school definitely ask you, okay, you need to know its factors 2, 9, and 10. It's 2, 7, 9, and 10. So the thing is that to actually form the final active, for 2, 7, 9, and 10, you actually need vitamin K. You can't have the protein by itself. It won't work. So what happens if you don't have vitamin K? If you don't have vitamin K, you have the protein part, but these enzymes now they can't function properly. So even though you have the protein, they're essentially inactive. So if you take all of these out of the equation, well, you can't have formation of, factor X needs vitamin K. You won't be able to, and so does thrombin itself. So without thrombin and factor X, you can't form fibrin, you can't have clotting. So this is why someone who has a vitamin K deficiency might have problems with clotting, or might have problems forming a clot properly. So they might have bleeding problems. So let's talk about some more terminology. So thrombus is a blood clot, and an embolism. So thrombuses or thrombi, or plural, they can lead to embolisms. They're not the same thing. So embolism is a blockage of a blood vessel by clot or foreign object. So it's not just clots. Clots can lead to blockages of blood vessels, but they're not the only way you can have a blockage of blood vessels. Like you can have air bubbles, or even or fat globules. They can also cause embolisms, but yeah, thrombuses, they're a frequent cause of blockages in blood vessels. And yeah, that's what we have here. So embolism is so you have a blockage in this blood vessel. Now, what we have here, so here we have a blood clot. So this is the other thing too. Well, I think we're going to cover strokes later on in Unit 2, but a stroke or a cerebral vascular accident, what happens? Well, the blood vessels that lead to your brain, they're blocked off. So and say it's being caused by a thrombus, how do you remedy that? How do you save someone from that stroke? Well, maybe you want to dissolve that clot, and this is why knowing coagulation is very important. So we know how to make a clot now, but how do you get rid of it? Well, you can do it by dissolving the fibrin, but how do you dissolve the fibrin? Well, one way you can dissolve the fibrin is, so there's a protein called plasminogen, and by itself in its original form, it's inactive and doesn't do anything to fibrin yet. But There's another enzyme called tissue plasminogen activator, TPA. This is an enzyme that can convert plasminogen into plasmin. And I know they sound very similar, right? And this is where you have to be very careful with your spelling, because sometimes, especially in this semester, there's often like words that only differ by a few letters, but they refer to different states and different things. So plasminogen becomes plasmin, but plasminogen is inactive. Plasmin is active. So what does plasmin do? Plasmin is an enzyme that breaks down fibrin. So this is why, like, especially for people who have strokes, like giving TPA is often, sometimes they just call it, they call it a clot buster. Why? Because TPA is going to make plasmin by converting plasminogen into plasmin, and this plasmin is going to help to dissolve that fibrin clot to restore blood flow to that area. So this is why it's also important not only know how to make a clot, but also how to get rid of a clot and also prevent clots as well.